Welcome to Beauceville.
Beauceville is a town of 6,175 inhabitants. It's a very vibrant community. The industrial park here is thriving, providing more than 1,000 jobs, and the agricultural community is very active and diversified.
Despite the vitality of the region, community leaders were faced with a problem common to many rural areas of Quebec. No new physicians had come to set up practice in the MRC of Robert-Cliche since 1994.
The Centre Local de Développement, or CLD, conducted a study.
avait fait une étude, disons, sur un peu, le CLD travaille un peu.
In other words, they did some work at the community level and realized that the MRC of Robert-Cliche was in desperate need of doctors.
The Co-operative de santé Robert-Cliche was established in 2008 to help medical clinics operate more efficiently and to recruit new physicians to the area.
I have to say that things changed faster than expected. We told ourselves that we'd be happy to get 1,800 members in the first year, but we reached 2,500 in no time, and the number just kept growing. Currently, we have close to 4,700 members, and we actually need to slow down a bit. Otherwise, we'll need more doctors. We want to make sure our existing members get good service.
Member recruitment is a critical step in starting up a cooperative, a step that requires a lot of work by the entrepreneurs.
In order for it to work, a co-op needs members, so we went out to the community. Of course, what we were selling seemed like a dream. We told them, we'll try to recruit a new doctor within the next year, but no guarantees. The people really liked the idea and said, okay, we're in, we'll join.
On vous croit, vous êtes sincère, puis c'est vrai que ça prend du recrutement.
So we did a lot of recruiting. We ended up with not one, but 4 new doctors, 3 at the beginning of the first year and 1 more the following year.
The Cooperative Development Initiative, or CDI, is a $19.1 million program over 4 years to help Canadians develop cooperatives and test new ways of using the cooperative model. The program is delivered by the Government of Canada's Rural and Cooperatives Secretariat in partnership with the Conseil canadien de la coopération et de la mutualité and the Canadian Cooperative Association. The Co-operative de santé Robert-Cliche received $50,000 under the CDI to develop its project.
It's not easy to find funding for that kind of organization, since we can't become guarantors individually. That's what makes it possible. You have ideas, a lot of ideas floating, but when it comes to funding, not everyone can find it. And that's what we got from you, adequate startup funding. And you can see what we've done with it.
Since its introduction in 2003, the CDI has provided support to more than 1,500 cooperative projects and helped develop more than 200 new cooperatives. Dr. Linda Fillon, who sees numerous advantages of practicing at the Coopérative de santé Robert-Cliche.
This has made it possible to create a bigger team because a regular office, which is what we were before, doesn't attract young people. We tried recruiting for years and years, but we're never able to recruit anyone. Never. So when we learned about the co-op model, we met with a lot of young people. Then we knew what they wanted, and we thought, this is going to interest them.
It goes without saying that having the cooperative is a privilege not only for the physicians, but also for the residents of the MRC. Véronique Bernard is very aware of that.
Having a co-op here closer to home is always better in terms of transportation and accessibility. If there's an emergency, it's much faster than traveling longer distances.
With people so involved in the cooperative movement, Beauceville and the Coopérative de santé Robert-Cliche are worth being studied and imitated.